Welcome back. Pregnancy brings many physical changes, including hormonal shifts that can significantly affect oral health, from increased gum sensitivity to a high risk of cavities and pregnancy gingivitis. Dental care becomes especially important during this time. To discuss how pregnancy affects oral health and why dental care is especially important for expectant mothers, we are joined by Dr. Lusa Eliakim. She's a dentist and she's with us. Good morning.
Good morning.
Great. Thank you so much for joining us.
Thank you so much for having me.
Now, a very interesting topic indeed. How do hormonal changes during pregnancy affect gums and overall health?
Okay, so hormonal changes, whereby now we have a high rise of the estrogen and progesterone in the woman, affect our gums in a sense that now the pregnant woman will start experiencing bleeding gums, or per se, let's say their gums are swollen. This is caused due to the high hormone levels, as well as, let's say, when you are pregnant in the beginning, they notice that they have a lot of saliva in the mouth. This then is caused by the high rise in the hormones as well. And now this harbors like a warm environment for the bacteria to actually thrive and then create cavities in the teeth, as well as you experience when you're pregnant, let's say morning sickness. Yes. So this is also producing acidic, like vomiting. This now wears down the teeth as well, and then they later experience teeth sensitivity. So all of this in a nutshell is just caused by how now the rise of the estrogen and progesterone in the body.
Now we've highlighted all these challenges and all these conditions, if I can call them up, that come up during pregnancy. Now, is it safe to get treatment whilst one is pregnant?
Yes, it's very, very safe. And I always encourage my pregnant mothers that visit your dentist. They will guide you throughout your whole pregnancy. Yes, we'll be limited that we cannot see you in your first trimester. Especially, we can see you, but we cannot really do anything in the mouth first trimester and last trimester. But there's a second trimester where you are 4 to 6 months, 4th month, 5th month, 6th month. There we can do elective treatments such as extractions, emergency treatments, cleaning, and also just to prevent if already your oral hygiene was not good, then we can at least counteract it and then take you to 3rd trimester. So it is safe, 2nd trimester.
So definitely in the 2nd trimester. But now, what if one finds themselves in the 3rd trimester? They've got these conditions. They have to wait until birth?
So what happens is that, let's say, let me give an example. A mother had a toothache before she fell pregnant, and then she falls pregnant, and then now in the 3rd trimester, that's when now the toothache has been exacerbated, so much pain. So what we do is that 3rd trimester is not safe, but it's also okay. Like we can do maybe an emergency treatment, and we can also perhaps make them sign consent that they agree to the certain treatment. But we try to, even if we are going to do things like x-rays to see the extent, we always protect them. Extra measures are always put in place, and we try to just do minimal. Yes.
Now, what is pregnancy gingivitis and how common is it amongst expectant mothers?
Okay, so pregnancy gingivitis is basically gum inflammation, a gum disease that happens during pregnancy, and this affects our mothers. So what happens is that a pregnant mother will start experiencing bleeding gums, swollen gums, redness over their gums, even when they are brushing or they are flossing. So now this is caused by the high rise in the hormones now. So I always advise them to visit the dentist. Then we will take care of them and give them proper instructions on how to cater their oral hygiene. But pregnancy gingivitis can be counteracted. It can be managed. You just have to now take care of your oral hygiene. Brush more, floss more. Yes.
Doctor, is there a link between gum disease and complications such as preterm birth, low birth weight? Is there a link?
With general gum disease, not high, but with severe gum disease. Let's say when now it's extensive, it has gone towards the bone. This is basically just high inflammation in the mother's body. So now when we have high inflammation, it's also not well in your body. You are not well maintained. So it can affect, but not so much.
What daily oral hygiene routine do you recommend for pregnant women? What can they do on a daily basis?
So what they can do is, so for our mothers, they must brush twice daily. morning and evening before bed, and they must get themselves soft toothbrushes because now their gums are very sensitive, so the soft ones are more user-friendly for them. And then also they can use alcohol-free mouthwashes. This is better for them as well. It will not cause so much sensitivity, and they can also be flossing more when they eat. And just to rinse, because some people experience morning sickness, so they feel like that toothpaste does not, it triggers their morning sickness. So they can just rinse, even with warm salt water. It can help.
Really back to basics, the salt water.
Yes, you are back to basics.
Yes. Now, doctor, there are always many myths and misconceptions and surrounding dental care and just even pregnancy in general. What would you say are some of these myths that you've come across in your time?
I've heard so many. I've heard one person once told me that, is it normal to lose a tooth during pregnancy? Like after every pregnancy, they'll lose one tooth. But it's not normal. It's a myth.
Where do we hear these things? Yes.
Some people maybe experience
And
it, but
believe it.
to be honest, that is mostly caused by your oral hygiene. And let's say before you got pregnant, you neglected that tooth, you know?
Yes,
And then when you got pregnant, now we can't do anything. So yeah, so you experience toothache, tooth problems, but you cannot lose a tooth because of pregnancy. You also hear someone say, no, you don't visit a dentist when you're pregnant, but those are just myths. We are there to guide you. We are there to educate you, so you can always come to a dentist anytime.
Now, what would you say as we wrap up? Somebody who says, I don't need that. I don't need to go and see a dentist. They're literally putting it on the back burner constantly. Pre-pregnancy, post-pregnancy, what message would you just have to say about overall care?
Overall care is that for pregnancy, you are having a little baby, so they are more important. So always care for the child rather than yourself. It may not be important to you, but you are maintaining the little one's oral health as well. You are maintaining their health, and you don't know what gum disease at what level it is. And always going for your consultations are very important, because a happy mother, a happy baby. So
Happy mother, happy baby indeed.
Yes.
Thank you so much for your time, doctor.
Thank you as well.